Hello and welcome to Chemspec Digital 2021 and the next session in the Regulatory Services Lecture Theatre. Before I introduce our speaker, please note that we are recording the session, and I invite the audience to put their questions into the chat function in the top right-hand corner of the screen so that we can have them ready for the Q&A session after the presentation. Now, ladies and gentlemen, I have the pleasure to introduce to you Dr. Marion Weber of CFCS-Consult, who will be presenting REACH Dossier Compliance Checks, Lessons Learned for UVCBs and Multi-Constituents. Marion, over to you.
Thank you, Jason. Thanks to the organizers for having this call in their program, and thanks for the audience for having dialed in. The talk of today will deal with REACH registrations of chemical substances and with the controls that the European Chemical Authority, the ECHA, is performing once a dossier has been submitted to them. In detail, we will look at some lessons learned from work we did, from registrations we managed, especially regarding two types of substances, UVCB substances and multi-constituents. The company I work with is a chemical consulting company, CFCS. We have offices in Germany. We are an owner-managed company. One of our owners, Felix, is also Chief Executive Officer, while the other owner is our Chief Toxicologist and Eurotox certified toxicologist. The presentation of today will look in detail at evaluations which the ECHA performs on REACH dossiers, and in particular on one step of the various evaluations, which is the compliance check of a REACH dossier that has been submitted. I will introduce the procedure the ECHA follows, and I will present 3 case studies, which gives examples from different dossiers and from different substances. The process of the compliance check from the ECHA is a 2-step process. So the registrant receives 2 communications, first a draft decision and then a final decision. And in between, the registrant has a chance to answer to the ECHA, to interact with the ECHA, and to make proposals and to react to the criticism that had been placed. So in particular, we will look at the strategies for preparing the reply to a draft decision, which will be very fundamental in how the ECHA will then react to these answers and how they will, in the end, draft their final decisions. And the question also is, between the draft and the final decision, why should one answer? And this will be addressed in the end of the talk. First of all, what does the ECHA evaluate? There are 3 major areas where evaluations take place. One is the examination of testing proposal. The third is the substance evaluation, where the member state competent authorities, the MSCAs, are involved. And the second one is the one we're looking at today, a compliance check of a REACH dossier submitted to the authority, which is performed by the ECHA, and eventually, but not necessarily, the member states may be involved. So the rest of the talk will deal with point 2, the compliance checks of REACH dossiers. What criteria are used to perform a compliance check? Or what criteria are used to select a substance for which a compliance check is being performed? Especially the ECHA is looking at dossiers where the substances have a high tonnage, so where the substances cover higher tier endpoints, in particular for human health and for the environment. The dossier selection is focused on substances that have a wide dispersive use, on substances that have potential hazards, on substances which are in the community rolling action plan, so the CORAP, either directly themselves or structurally related, which is an index for substances which might become critical and which need a closer look. And the dossier selection, as a final point, will look at such dossiers where higher tier endpoints for more complex toxicological endpoints have been substituted by certain adaptations rather than performing the complex higher tier toxicological studies that might be requested from the REACH regulation. The critical endpoints for every chemical substance are those that might cause potential severe hazard. One of them is mutagenicity or genotoxicity, repeated dose toxicity, then prenatal developmental toxicity, toxicity to reproduction, carcinogenicity, long-term aquatic toxicity, biodegradation, and bioaccumulation. In the last years, for high tonnage substances, one of the major issues was to look at reproduction toxicity. And in my talk, I will concentrate on issues that have been raised in compliance checks by the ECHA, which regard reproduction toxicity. I will present, as I said, 3 case studies, and all of them have the same structure. We will first look at the substance in question. We will then look at the adaptations which were used in the dossier rather than presenting the original new toxicity data that were requested. We will then look at the draft decision of the ECHA, where they point out why they do not accept the adaptations and why they have been rejected. In this draft decision, the ECHA will place additional testing requirements, and the registrant has, point 5, the possibility to comment the draft decision. And we will look into details regarding the possible comments and, as a consequence, point 6, what the outcome was, which is the ECHA final decisions. In these 3 case studies, we will look at the lessons learned, at the perspectives, and then we will come to a conclusion how to approach draft decisions and how to prepare a necessary answer and why this should be done. So now, based on this agenda, we will look at 3 different cases. Case 1, the substance. The substance of case 1 is a UVCB substance, which stands for substance of unknown origin, of variable structure, of complex structure, or of biological origin. In our particular case, we have a substance which is made up from fatty acids, which are chemically substituted. For the same substance family of chemically substituted fatty acids, we had in our hands several dossiers for related substances which shared the same overall structures, and at the same time they differed in the chain length of the alkyl chains. They could vary from a C8, C10, C12 up to C18. Also, all of these substances were listed in the CORAP, so in the plan of the ECHA, to look at critically at the dossiers submitted. For this substance, the adaptation we applied in the dossier was the following. We did not perform higher tier reprotoxicity studies, but we waived them with the following rationale. We had low toxicity and we had no systemic exposure. The data we based our adaptations on and our data waiver on were that the systemic toxicity was low with an LD50 higher than 2000. There was no indication of systemic toxicity in subchronic and chronic studies. We had no evidence for teratogenic effects in an OECD 414 study, which was available. We had no genotoxic properties. The relevant exposure to humans was not by the oral route, but only by the dermal route. And the resorption in humans via the skin was 0% as based on in vitro data. So that data set made us think that according to the REACH regulation, data waiving for higher endpoint reprotox studies was possible. Why did the ECHA reject our approach? They argued that the waivers for higher tier reprotox and also repeated dose studies were not completely coherent, because yes, we did not have indication of systemic toxicity, but we based this on a study where 300 milligram per kilogram was the highest dose, while they would have expected a highest limit level at 1000. We said we had no teratogenic effects. Yes, that is true, but we had this only on one species and the second species was missing. Normally data are requested both for the rat and for the rabbit, and we only had the rat. Yes, we had no genotoxic properties, that was not criticized. Yes, human exposure was dermal, not criticized, but while in vitro we had 0 resorption, in an in vivo test there was a minor resorption through the skin in the area of 2 to 6%. That were the arguments of the authority for not accepting the data waiver for reprotox. What did they request us to do? They asked us to perform an OECD 414. This is a teratology study in the second species, the rabbit, by the oral route. And they asked us to perform an extended 1-generation reprotox study, which is reprotoxicity fertility, OECD 443, including 10 weeks pre-mating exposure for the parental generation and cohorts 1A and 1B. The positive point was that for all 4 substances we had in our substance management, and where the dossiers were very similar, because the substances themselves were very similar, the ECHA requested these 2 expensive and long-lasting studies only for one substance of the 4, and right from the start they allowed us to use these data as read-across data for the other substances. How did we comment to the draft decision? We questioned the need of the second species for the teratology because we knew that there were some local gastric irritancy effects, and that's why we did not want to use this substance in further and sensitive animal testing for the rabbit. And our comments then went that we added in our answer to the draft decision more data on subchronic toxicity and on teratology, which we had from the read-across situation. We did provide this information as print files because we could not have them considered if we had made a dossier update after the draft decision. We extended our justification for read-across with much more data, and we delivered an argument why the gastrointestinal irritancy toxicity would make the substance not suitable for a second species in the OECD 414 study. What was the reaction from the ECHA? The outcome was a final decision we received, and the final decision is available, and they did not change their opinion on the basis of the arguments we provided when answering to the draft decision. That is case 1. We now come to case 2 and look first at the substance. The substance in this case are again fatty acids, UVCB substance, with an ester bond bound to a cyclic organic compound. What adaptations did we put into our dossier? We used, rather than data on the target substance, we used read-across data to a structurally related compound. And we justified it because our read-across substance has shorter C chain length, which is supposed to be more bioavailable. And so we thought, and we argued, that with read-across to shorter C chains, the target toxicity would not be underestimated. But we knew that in a very old dossier prepared 2011, 2012, the justification for read-across that we had in that dossier was rather poor and was not up to standards that were introduced after the early years in REACH. How did the ECHA argue for not accepting our approach and our data adaptations, the use of read-across data? Why did they not like that? They argued that the substance characterization of the read-across substance was insufficient, that we did not sufficiently discuss the predictivity of the read-across substance based on the structural similarities and dissimilarities. We did not have in the old justification for read-across an up-to-date data matrix, which would have been necessary according to the newer standards. And one of the major issues, we had no bridging data between the target substance and the read-across substance for medium length higher tier studies like in OECD 422, and we had no information on toxicokinetics or metabolic pathways. We considered the last two were the most fundamental issues. And now we see, based on these criticisms, what the ECHA requested us to do in their draft decision. What they asked us to do is skip the read-across and perform all data, produce all data on the target substance. So we were asked to do the whole package of genetic toxicity, an OECD 408 90-day study, teratology study, OECD 414 in the rat and in the rabbit, and a higher tier reprotox study extended 1 generation, all on the target substance, plus some ecological data, excuse me, growth inhibition in aquatic plants, short and long-term testing on fish, and aquatic invertebrates. How did we comment to the draft decision, trying to influence how the ECHA would look at the data and draw their final decision? Our comments was that we would improve the justification for read-across from the 2011 low standard to the much higher 2018 and onward standard. And that was done during an informal telephone conference with the ECHA. ECHA themselves encouraged us to provide toxicokinetic and hydrolysis data, which could strengthen and confirm our read-across approach. And they accepted, or they acknowledged, that a higher tier bridging study like an OECD 421 could be suitable to support the prediction of the read-across that we were planning to maintain. What did we do as a comment to the draft decision and after having had the phone call with the ECHA? We provided a very detailed substance characterization. We provided a detailed toxicokinetic expert statement. We provided a justification for read-across according to the current standards laid down in the RAF. We provided robust study summaries of the target, of the source substance, of the read-across substance in print files, and we provided QSARs both for source and target substance to allow a comparison and show similarity. What did the ECHA make with our comments, and what was the outcome of the final decision? The final decision is available. The ECHA did acknowledge the arguments we provided, but in spite of all our efforts, the final decision turned out to be identical to the draft decision. So No luck, even though we got the feedback that our argumentation was acceptable. Third and last case, somewhat different substance. The substance is no longer a UVCB, but a multi-constituent aromatic organic substance, in part with epoxy groups, which is reactive. And the major constituent has a presence of more than 50% in the overall substance. In that last case, which adaptations did we provide in the dossier? We used weight of evidence and a waiver to not perform advanced reprotox studies as laid down in Annex 9.87 in the REACH dossier. The column 2 allows not to perform or suggests not to perform reprotox studies under a certain set of arguments. And among those was the fact that we had no indications for critical issues in repeated dose toxicity. We had a classification as reprotox category through, so we knew there was a problem, and we made we used the H361F phrase, suspected to damaging fertility. So we classified the substance and made the alert, and the harmonized classification was based on the major constituent. So we thought that having done this, we would not be asked to perform further reprotox studies because we had already acknowledged and classified for reprotoxicity. What was the argument of the ECHA for rejecting in their draft decision our adaptations? They said the waiver according to Annex 987 column 2 was not admitted because we classified as a category 2 and not as a category 1A or 1B. So that makes a difference. And they considered the weight of evidence used with produced using OECD 408 and 414 studies not sufficient because there were no data in reprotox on a second generation, on immunotox or neurotox, and the classification and the phrase H361F does not address these concerns. So these were the objections and the reason for the ECHA to reject our adaptation. What did they request us to do? They asked us to perform a complete OECD 443 study, an extended one generation, with all cohorts 1A, 1B, and also 2A and 2B for developmental neurotoxicity, and cohort 3 for developmental immunotoxicity. So the doubts the ECHA had on the reprotox classification translated themselves into the request of the most complex study and the most complex protocol study plan version of this study, the extended one generation. How did we comment to this draft decision? We had unfortunately done a dossier update, which for some strange reason was not disseminated and was not available when the ECHA performed their compliance check. So there was some kind of hiccup in the system that did not allow the ECHA to see our latest update. As a result, because we pointed that out during an informal telephone conference with the ECHA, as a result, they did grant us more time. And then they argued that the ongoing tests with the constituent will probably lead to classification reprotox 1. And that was our argument for saying, then you don't have any more valid reason to ask us for an extended one generation study. The comments to the draft decision we sent was that we requested to postpone the final decision until we had generated some new in vivo data on the constituents, because we thought and we think that this might critically influence the extended one generation and the study design. And we questioned the need to include cohorts 2 and cohorts 3, neurotox and immunotox, in a study design for extended one generation. What did the ECHA say to that? In fact, they did listen to our arguments. They did remove cohorts 2A and 2B from the testing requirements. They notified the member state committee. Among the member states, one of the member states refused to accept that and continued to ask for cohorts 2A and 2B. This was published in a note 57, and the fact was that there was no unanimous agreement among the member states, and this is still ongoing. The issue is still open, so there is no final decision available yet. This last example brings me to lessons learned. It seems like adaptation for the most complex reprotox study, the extended one generation reprotox study, adaptations for that are not likely to be accepted. To have a chance to really be able to waive the extended one generation study, one should at least present a one generation study in the dossier, and such data are rather rare. So in the end, as said in point 1, it is unlikely that an extended one generation can be avoided if it is required in the testing requirements of the REACH regulation. There is, for the registrants who receive an ECHA compliance check, a very high effort which goes in to prepare a reply and to comment the draft decision. It needs a lot of information support, and the information support has to be given in robust study summary print files, because in the course of a discussion of a draft decision, the ECHA will not accept and look at further dossier updates. In most cases, we have seen regarding reprotox endpoints, the final decision was identical to the draft decision, notwithstanding the effort that went into the draft decision and into answering it. And in some cases, the final decision was even worse than the draft decision, because the member state, some member states may have added additional and worsening requests. So what is happening after a final decision? Once you get it, you can either accept it and perform the studies the ECHA requires, or you can try another adaptation of the information requirements in a different way from what you have done before, by read across or by weight of evidence. In the second case, the ECHA could accept, or the ECHA could follow up with a new draft decision with a new compliance check, or the ECHA could issue a failure to respond notice and pass the whole practice to the member state competent authorities, and that would normally be the member state competent authority of the nation where the lead registrant resides. So we looked at how, to recap, we looked at the process of ECHA dossier evaluations, in particular at the compliance checks, at the procedures. We looked at some case studies, and we gave examples from different substances. We pointed out what strategy we used for our replies. And since we saw that a lot of effort goes into the replies, and the outcome is more than likely similar to the draft decision, so the ECHA will rarely move from their original opinion, why bother to answer? That's the last question. Why go through all the effort, which is quite important, to get in the end the same thing you had gotten in the draft decision, but now as a final decision? There is a reason why this should be done, and that is in case of continuing disagreement between the lead registrant and the ECHA. There is a possibility to address the Board of Appeal, but this can only be done if a draft decision has been commented or contested. So just to keep your options open, it is worthwhile going through the effort and providing an answer to a draft decision. This talk has already been published because it was originally planned in an earlier version of the Chemspec that got cancelled due to the coronavirus situation. But who is interested in more details of this presentation, it has been published under this title. Authors are myself and our owner Barbara Lohmann, and it has been published in Chemistry Today, volume 38/6 in 2020 on page 66 to 69. That is all, and I thank everybody for listening and for your attention.
Thank you very much, Dr. Weber, for that informative presentation. We've come to the Q&A session or part of the session at the moment. I would invite the audience now to post their questions using the chat function in the top right-hand corner of your screen, so those can come through to us. And this will be about 10 minutes, depending on the number of questions we receive. Oh, I've just received a question, Dr. Weber. So here we go. In the process of compliance check, how much time does it take for ECHA to issue a final decision after they have sent a draft decision?
Okay, from the experience we have with our clients with the lead registrants, cooperating with the lead registrants, there is no defined schedule. The ECHA may take as much time as they want, as they need to go through the issues. We had examples where a final decision would come in 6 months, even 9 months after a draft decision. While in the course of the process, the time for answering to the draft decision is normally limited to something like 4 to 6 weeks. So the draft decision comes, you have 4 to 6 weeks to have an informal telephone call and then to provide your written answer to the ECHA. And after they receive that, they may take many months to come down with a final decision.
Thank you for that. We have received another question, which goes like, does a failure to respond notice have an influence on the authorization or manufacturing or importing of a substance or the substance?
To my knowledge, no, because at present we have several issues with the ECHA where the strategy of the lead registrant differed from the expectations of the ECHA. So they did issue failure to respond notices, which essentially in a first step means that the ECHA will stop to look at this dossier and at the ongoing process of responding to their requests, and they will pass the responsibility for this supervision to the national authority of the country where the lead registrant is registered. In our experience with the national authorities, they first request more information and an exchange on the topic. And so far, I have not seen any drastic actions coming from the national authorities in the course of this process.
Okay, it looks like you also answered the other question that we have received, which I'll read out, but I think you have answered that. It goes along, what happens after receipt of, what happens after the receipt of a failure to respond notification by ECHA, by which ECHA transfers the further handling of the case to the member state competent authority? What experiences do you have with interactions with MSCAs? But I think you just covered that.
Well, there are some more things that could be added, really, because while the ECHA has standard pattern, I would say, on how they perform compliance checks, on how they interact with lead registrants, and on how their communication goes, this standard pattern of the ECHA is determined by the fact that the ECHA is one agency. They all follow the same set of rules, and they are all located in their respective departments where they do their jobs, among them also the compliance checks. Once we go to the level of national authorities, the structure of the national authorities is very different, and their way of communicating and of interaction is too. For example, in some countries, like, for example, Italy, there is one general agency responsible for the whole country and for all answers. So it's always the same 3 or 4 people that interact independently from if the lead registrant has their office in Milan or in Rome or in Naples. In Germany, that is very different. For example, in Germany, what the Germans call the Regierungsbezirke, which is a relatively local administrative body, is responsible, and that would be a different administrative body for Frankfurt or for Cologne or for Hamburg or for Berlin. And those people, different from a general national authority, which in Germany would be the Bauer, for example, those people in the regional authorities not necessarily are experts. So their replies may be more formalistic, more tick box checking, with all due respect, simply because at that point you don't any longer argue with toxicologists or with safety assessment people, but you argue with people who have to enforce the legal compliance from a bureaucratical point of view. Then they may involve the technical experts from the national authority in Germany, the focus point, which is the Bauer. But in a first instance, you may just find questions regarding formalistic aspects or regarding timing, regarding deadlines. And final point, also the way they interact is very different. Some authorities would very rapidly address the lead registrant and make their requirements in writing. Other agencies would not be so immediately active. And in all cases, our experience is that it is helpful for the lead registrant to proactively address the member state authority once the lead registrant has been informed that his case has been given to the national authority. Being proactive and showing the willingness to cooperate and to communicate and asking what the respective authority really expects from you is always a helpful hint.
Thank you very much. Thank you very much. It looks like we have come to the end of our Q&A session. So this would be actually the end of our session. I'd like to thank you, Dr. Weber, for a brilliant session and a very informative talk. If there's any questions, I'm sure they can direct them to you.
Absolutely.
And then I would like to wish yourself a pleasant day further. To our audience, thank you for joining us. Continue enjoying Chemspec Digital and have a great day. Thank you, everybody.
Thank you. Thank you, everybody.